Hello again, my name's Dave Zolna. Well, I caught a little bit of Fox News this morning, and guess what they were talking about? Oh, yeah, you got it, they're talking about the Less Than Affordable Health Care Act, aka Obamacare. And one of the main reasons that this criminal dysfunctional administration said that they launched this program is to make certain that people that had pre-existing conditions could receive proper health care. Isn't that nice of them? Well, there's a little glitch. Every once in a while these little glitches pop up. That's why, so far, Obama's changed the law 29 times all on his own. Is he the man or what? Screw Congress! Anyway, there's a difference between drugs. There's the generic, and then there's the brand name drug. Like, for example, Viagra. Now, Viagra cannot be sold as anything other than Viagra because they have a patent. And once that patent runs out, then other companies can make a generic drug which has similar compounds. Now, the problem is that they're finding that there's a lot of drugs that don't have a generic substitute. And many of those drugs are being prescribed to patients that have certain conditions. Let's say, for example, AIDS. Well, because AIDS it's been out for quite a while, but there are drugs that cannot be manufactured because they've got patents that have still not run out yet. So, if you're one of those unfortunate people that have a pre-existing condition, and the doctor has prescribed brand name drugs, since there are no generic substitutes, guess what? You pay for it. It's not covered by the Less Than Affordable Care Act. And some of those drugs can be very, very expensive. So once again, Obamacare is full of holes, just like Swiss cheese. You hold up a piece of Swiss cheese, you got all these holes everywhere. Same thing with Obamacare. It's a complete farce. Once again, folks, it was never intended to work. What it's designed to do is exactly what it's doing. Distract, divert, to deceive. I've actually made up that term, distract, divert, to deceive. It's in an awful lot of my videos. So, I wonder if he's going to execute another one of those executive orders and make another little minor adjustment to include brand name drugs for pre-existing conditions. Unless they do that, a great number of patients with pre-existing conditions will not be able to take advantage of the Less Than Affordable Health Care Act. What do you think? I told you what I think.